Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about Gluma desensitizer. Let's start. So today's episode is a very interesting episode as I have been using this product for quite some time for dentinal sensitivity and dentinal hypersensitivity. Before I talk about this product, let me tell you this is not a paid promotion, but I am doing this for patients who are suffering from dental hypersensitivity or dental sensitivity and their home care regimen has not proven that effective and they're not able to enjoy their food and drinks and beverages because of the fact that their teeth are too sensitive, either due to gingival recession or due to faulty restorations or caries lesions or any sort of erosions or any sort of abractions or cervical abrasions. Now what I would like to talk about is sensitivity and hypersensitivity. Sensitivity is usually ascribable to a cause. It is a very sharp and painful response to any chemical, osmotic, tactile or thermal response. Now once this sensation is not ascribable to any particular cause, as I previously mentioned, this is known as dentinal hypersensitivity. Now this happens a lot in periodontal patients who have gingival recession, patients who have any sort of erosions in their teeth, patients who have a lot of cavity lesions, patients who take a lot of sodas, a lot of dietary or acidic drinks. So that's where the enamel wears off and the dentin is exposed, and that's why you get dentinal hypersensitivity, because of the fact that there is a dentinal fluid in the dentinal tubules, and due to the variations in any sort of thermal changes, osmotic changes, tactile changes, that's why, or chemical changes, you feel that there's an upward, an outward or inward movement of the dentinal fluid, which gives the sensation to the nerves and gives the sensation of dentinal hypersensitivity. So how to cater to this is very simple. The dentinal tubules are usually either open as they are exposed to oral fluids and abrasive action of toothbrushes, or just gingival recession and denudation of the cementum. So there are two mechanisms of actions. Either you can block the dental tubules or you can reduce the response, the excitatory response of the nerve fibers or the mechanoreceptors around the dental tubules by adding chemicals, and so that their potential or action potential is kind of made less reactive to the stimulus. Now what you have to understand that a lot of times, most of the times, that the home care regimen that is provided with toothpaste, desensitizing toothpaste and mouthwashes, they're pretty good, but they have a certain stature of limitations when it comes to the healing potential and the kind of effectiveness and the efficacy that happens, which kind of plateaus over some time. In that case, and especially if you do not have the access to something known as lasers, which also can be used for desensitizing purposes, you can go for in-office desensitizing protocol using something known as Gluma desensitizer. Now Gluma is the breakup of glutaraldehyde and hydroxyethyl methacrylate, which is HEMA, and it is a compound present in water, and this is used as a solution for in-office application on teeth surfaces, so that you can get desensitized and you can have your food without any sort of psychosis of any hypersensitivity. Now the mechanism of action is very simple. It is postulated that the peripheral dental tubules, there the tubules can get blocked with the help of the precipitation of the colloidal proteins, and thereby the reduction of the permeability of the dental tubules, thereby causing less susceptibility or less response evoked to hypersensitivity or sensitive potential. Now the application is very simple. You first have to clean the area, and after that what you can do is you can air dry the area for some time and then do an application of 30 seconds followed by again air drying and then 30 seconds again and then again air drying, or you can do just one application of air drying the area completely and then using the protocol for 60 seconds and then just coating it around with a microbrush applicator tip, and therefore you shall be done. Now the beauty about this thing is that it is relatively inexpensive compared to laser treatment, and it is more effective compared to the home care regimen. My personal recommendation would be, if your home care regimen is not good enough for whatever reasons, if you're having dental sensitivity, then you have to definitely treat the ascribable cause. If you have dental hypersensitivity, you have to go for, it's better to go for a mix of the in-office desensitizing protocol, that is your Gluma desensitization, along with the home care regimen with the help of a desensitizing toothpaste or a desensitizing mouthwash. So this was today's episode. Please like, share, subscribe and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. just drop me a message with your name, your location, and the common oral health problem that's causing you discomfort, and drop me a message on WhatsApp, and I'll get back with the response to you within the couple of 2 or 3 days. Kindly be patient with me, and if you have any queries, doubts, apprehensions, or insights regarding the content, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.